It is a great pleasure that I introduce URC's President, Earl Gast. Earl brings 30 years of experience in government and private industry, leading strategic, results-driven programming and implementation, and having previously served as the Assistant Administrator for the USAID Africa Bureau and having worked in the private sector as well. Earl, the floor is yours. Thank you.
Good morning, good afternoon, and good evening, everyone. And thank you, Hala, for the introduction. I'm going to try and turn my video on since I did wear a suit and tie today, and it says it cannot work. So like Paul, I will be resigned to just having my face on the screen. And Paul, it was great to see you, even though you admitted that that was an earlier picture of you. Welcome to this virtual knowledge sharing forum that will contribute to an already existing robust conversation on TB detection, prevention, and treatment. Understanding the gravity of the TB epidemic back in 1993, the World Health Organization declared a global TB emergency, calling on national governments, international organizations, and leaders from around the world to act. Since then, USAID, in partnership with national governments, civil society organizations, and the private sector, has saved more than 58 million lives, implementing evidence-based TB interventions and programming. There remain many steep hurdles to cross before we reach a TB-free world, but as we collectively continue to develop and apply new digital health technologies, we will be closer to achieving that vision. Today, we are expecting to have about 1,000 participants. I see we're under that number right now, but as the day goes on, I'm sure more will be joining us, who represent more than 60 countries, and all of them are answering the call to action. Over the next 2 days, we will have the opportunity to hear from national TB programs, donors, academics, the private sector, and other experts. We know that success of our shared vision depends on both a moral and scientific imperative to share knowledge, information, and best practices that come from a diverse range of stakeholders. Through participation in this forum, we have decided to take action in the fight against TB. We come as equal partners who are here to share expertise that will help shape our decision making. Over the last decade, URC has had the privilege of implementing USAID's TB Care 2 project. Thank you, USAID, during which we work with national TB programs and other TB stakeholders to develop and scale up digital solutions to control TB and MDR-TB. Globally, the project has implemented more than 54 multi-year activities to control and prevent the spread of TB and MDR-TB. All good things come to an end, sadly, and so that is the case for this project. As the TB Care 2 project concludes later this month, we hope that through this forum and other activities, there will continue to be the same level of collaboration that led to significant developments in digital health technologies. This information will take us one step closer towards achieving our shared vision of ending TB. Indeed, some of the most successful aspects of the TB Care 2 project have been in development and institutionalization of various digital health technology. Paul mentioned the TB Star in Nigeria. I'm going to talk about the Connect TB mobile app that was introduced into community-based MDR-TB programs in Bangladesh and South Africa. As a result, the application increased retention rates to 90 to 100%. Later, an assessment conducted in South Africa found that Connect TB was the most cost-effective patient management solution at just $76 per person. That's just 10% of what it was costing through the traditional community-based TB programs. As we adjust to our new COVID reality, where Zoom calls such as this become the norm, we should pause and reflect on the technological advancements that have made global collaboration possible during this time. While I'm sure many of us would have preferred to meet in person today, the accessibility of this conference has made it possible to connect with a multitude of experts who share a common vision, a world free of TB. Thank you to USAID for sponsoring this collaborative event, and thank you all for participating in this forum. Back to you, Hala.
Thank you, Earl.